lot of hydration. Um, let's see, what else did they do? They did a lot of tests, a lot of blood tests and stuff. My blood's been kind of all over the board. Um, it's all available on my chart, so it's linked to the university. You could look at it.
No, I'm a little limited in what I can get from University of Washington, but I have your hospital summary.
Oh, okay. So anyway, made it through that. I had a few things that happened that were kind of weird there. I've been bedbound since the last time I saw you, and it's been pretty miserable. I've been to dermatology, and I switched to a new primary care doctor. Olympic had me going to a temporary primary care every 3 months because they were short staffed. And with my condition, it was just too difficult to continue trying to explain everything. And so I'm going to a new primary care here where I live in Port Angeles. And so she wanted me to have a consult with you, to make sure that I was doing the right things. And so basically, that's why I'm calling. I'm not sure if this phone, if I turn it, let me see here.
You can see it, whatever you aim it at.
Whatever I aim it at.
Yeah.
So, can you see my legs?
Yeah, I can see your legs. Yeah.
Okay, and then are you able to see my arms?
You should take off
In
your
your
shirt.
hands. Yeah.
Okay. I wanted you to see what I'm looking like. This is about 6 days after the hospital. So
Yeah, you off the antibiotics, or did they keep you on that?
I stayed on vancomycin for 6 days, and then 1 day of Keflex and
Okay.
Cephalexin.
what was it called?
Cephalexin.
Cephalexin and one other one.
Okay.
Let me see what it was.
That's okay. You're off them now.
Right, doxycycline. And so so I'm off those now. I don't know if you can see me better if I kind of show you. Anyway, I'm missing pretty much all the skin on my body.
Yeah, it all came off at one time.
Yeah, and
Slowly, huh?
instead of in patches. So every 3 months I get the cycle where takes about a month and a half to cover my whole body, then about a month and a half to heal, and then I hopefully get a couple weeks in between before the next one hits. This one's done something different. I don't know what the COVID vaccine did to me, but it's not healing like it did last time I went to the university. I'm still getting hypothermic, where my body temperature drops at night down to 96.5 to 97. I wrap myself in an electric blanket.
You lost 60 pounds.
I lost over 50 pounds.
Since we last see each other.
Yeah, probably since the last time I saw you. I can't remember what my weight was. It's gone up and down several times. Right now, I weigh about 180. And
You changed your lifestyle.
I changed pretty much everything in my life. All of the food that I used to eat, I cut out everything and made it a plant-based diet. Cut out all white sugars, all sugars completely, and was able to reduce my cholesterol to a normal level, and went from pre-diabetic to a normal level. My blood pressure actually went down quite a bit. I looked at my records, and the first time I was at the university, my blood pressure was 240 over 200. And this time, it was 90 over 55. So quite a big difference.
Yeah, with those all changes you've made to try to be more healthy over the last year. Is that right?
I finally got to where I didn't know what else to do basically, and so I met with a nutritionist and changed everything about my diet, added a bunch of supplements like collagen and olive oil and vitamin D and vitamin E and
Good.
a whole bunch of stuff. And I haven't even begun finishing taking all the supplements. I went through a elimination period where I stopped eating everything and then added things really slowly back in. And so I haven't even started all the supplements yet. But the collagen seems to help with the healing process.
Yeah, that's apparently what it does. I don't know that much about it, but yeah.
For the skin, yeah,
Right.
I lose about 5 to 6 layers a day of skin, and it just comes off in either sheets or chunks,
Flakes.
and a lot of flakes, and so I'm using about 6 or 7 different type of topical medications. Uh,
From
one,
a dermatologist?
yes,
Okay.
one of them is a steroid based. The other ones are moisturizer based, and some are like almost like petroleum jelly, triacinolone, fluocinamide, calcipotrine. That's a
Well,
vitamin.
maybe that's why your healing's a little bit different this time. I mean, you don't look like, it looks like actually fairly good for having just come off everywhere, but maybe that's why it's healing differently.
It might be. I don't know why it would impair the healing. I would think it would heal faster, but I've never
Well, it
had.
probably heals differently.
Okay.
Yeah, he didn't say it was.
I've never
I mean,
had.
would be my guess. I'm not a dermatologist, but I know with like surgical wounds, it, things kind of heal from the bottom up. And I think with you, you're crusting over pretty quickly.
Right.
So I don't know.
Okay. Um, let's see what else here. What?
Itching.
Oh yeah, I go through a really bad period of itching. Um,
Getting any sleep because
I don't.
But
Uh, I sleep sitting up with pillows around me. If I try to lay, I actually start to rip my back, my legs, and my stomach will start to rip, and I'll bleed. Um, so I take Benadryl
it's so painful.
and let's see, Zyrtec, which is like an allergy medication, and
yeah, that's good.
hydroxyzine. And the Zyrtec actually works the best, but you can only take like one every 24 hours. So that's sort of keeping my sanity. Um,
Yeah, that's hard. I mean, that's
You
I
need to
guess
make
your
one of
only
those
options.
specials now.
so, do you have any questions for me?
I don't. I mean, from what I can tell, you're on 70 milligrams of methadone a day, and then about 4 of the hydromorphone, right?
Yeah, 16 milligrams of
And
hydromorphone, and I've been on
and
that for about 5 years. Um, it's the lowest dose that I've been on since this whole thing started, and so I feel like I'm starting to get more used to it. It's not lasting nearly as long as it used to. Um,
the hydromorphone, you mean?
but both of them really, the methadone, is a real stable medication that I think does really well for me because it doesn't have a
Yeah,
lot of ups and downs. It just kind of
right.
stays really level. The hydromorphone doesn't seem to last like the full 4 hours. Um,
It doesn't. It never does orally. It lasts about 2 hours orally.
okay, so there you go.
It's a short
um,
acting. It's a short acting
Okay. So maybe that's the problem. Is it's I I guess I've expected it to last 4 hours based off the dosing.
Well, the other problem is, if you look at equivalent dosing, you're like 1,000 milligrams of morphine with the methadone, and adding some hydromorphone is not going to add anything. It's like a drop in the bucket.
To
So
to the
methadone, your main drug, and hydromorphone, I'd be surprised if you even noticed it.
well,
And the fact that you've been on it long enough, I mean, your brain's just tolerant to opioids, and there's nothing that can change that.
right. Now, when I was in the hospital, they
What would he suggest for better pain management?
they gave me I'm trying to think. They gave me the same methadone, but with the dilated, they gave me some of it by injection, and that was a
That's only available. Yeah, it's only available in hospitals. I mean,
okay.
it's like 5 times stronger than the oral form.
Yeah, I noticed a
Milligram for milligram is 5 times stronger.
right. I noticed
It's
a
not
big
a bit. I
difference.
mean, the only thing I could recommend for you, if you haven't talked to palliative care, that would be a good option.
Okay, and
Have
what
you ever had a palliative care consult?
I asked my other primary care doctor at Olympic, and he said that he didn't think it was appropriate for my situation.
What is palliative care?
What
I
what
do.
what
I
what
mean, I could try to have them.
what do you define palliative care as?
Someone with a chronic medical issue like
Okay,
you that needs additional support other than primary care. I mean, hospice is end of life care. Palliative care isn't. I mean, I have some patients on palliative care for respiratory problems that they're probably going to die from 3 years from now.
right.
You know,
And when
they
I
may be
saw
able to
you
help.
when I saw you last, you had mentioned to me that you wouldn't be surprised if this didn't start to affect my internal organs, and you were right.
I don't know about that. I never knew that. I don't think. I think that was one of the other doctors.
Oh, I remember it from you because you and I had a pretty good talk. And anyway,
Yeah.
I had two endoscopies where they did find the lesions down my esophagus and into my
Yeah.
stomach. So I'm taking proton pump inhibitors for that,
Yeah.
and the olive oil sort of coats that. Um,
Big
but
part of your diet change was that.
the big part of my diet change was that, and I've had
Well, I can talk to your primary care about the medications. I don't have any great answers for you. I mean, I
okay,
think the hospital notes said they thought you were doing well with your present dosing, and they didn't recommend any changes. So since they've actually seen you in person, I mean, I would go with that also. But I do think it would be worth at least having a palliative care consult to see if you are a candidate. If you're not, that's fine. But without a consult, you never know.
right.
I don't know anybody. I don't know the palliative care group up there. I'm sure they have one. I can try to find out. I'm actually not going to be in the office till next week, but I'll try to find out if I can.
We'll come to Seattle.
Send them a consult. All right.
Okay, is it something that I could get driven into Seattle to do, or is it something that?
No, they usually come to you. Is the thing.
Okay,
They usually make house calls and they have nursing. They come out and check on you, and
But Olympic doesn't
they're just
have.
more for organization and more hands-on help for patients that have significant chronic illness.
Olympics having a really hard time with
okay.
holding on to their doctor.
Yeah, Olympic, I don't know if you're aware, but they're having a really hard time holding on to doctors. Right now, they don't have any cardiologists.
There's a Swedish is everywhere. It's a nationwide problem.
Is it?
I mean, they've had doctors retire in their 50s because of the last 2 years, and it's going to take 8 years to even get close to getting back to where it was. I mean,
Right.
the workforce is about a third less of what it used to be, and nursing's probably even more than that.
And without being protected for COVID, I'm basically at risk of just dying from it because it'll kill me. So I'm at a point where I'm
You got to be careful. I
more.
don't know. I can just do some research, and if I can find find a place up there, I could call them and see if they would at least do a consult.
Okay. Do you want to speak with my primary care doctor?
Yeah, I'll just put it in a note. I mean, she can see my note, but I'll give her a call if that would make her feel better.
Okay. Do you know who she is?
Brenda Powell?
Yes. Okay. So
Yeah, I got her number right here.
okay.
Yep.
And then what else can you, if I don't get, if they don't have palliative care in this area, what you're saying I'm at a maximum amount of medication?
Well, yeah, more methadone won't help you any. I mean, you're already at the point that you're at an addiction dose, basically.
Right. But if I increase it,
the methadone,
if I increase it
that won't help.
to 100 grams a day, milligrams a day, I get double the help.
For about a couple months, and then you'll be right back where you started.
Well, not necessarily. I've had this for 12 years.
You're going to get tolerant to whatever dose they give you.
So is it worth it to just die or to be tolerant?
No, you get tolerant, so it's not effective. But you're not tolerant to the side effects. Is the problem. So you may be able to go higher, but you're going to start having there's a cardiac risk with high dose methadone.
Well, yeah, you have the QT prolongation, but I don't have that problem. And what I'm wondering, is at what, excuse me?
Said you've never been 54 before. That's more common the older you get.
Yes, the older you get, the more common it gets. But I'm at a point where I'm going to buy a gun and take care of it myself if I can't find help. I don't know what else to do. So is it worth it to be...
There's no easy answer. I mean, I don't have an answer for you.
No, but there's got to be a risk analysis. Is it better to be on a higher dose of medication and have a bunch of risks, or is it better to lay in bed?
I'm telling you, I don't think it would help you.
But I've done...
You're past the point that methadone is helpful from a pain standpoint.
See, and I don't agree with you because I was...
Your prescribing doctor, if they're comfortable with that, that's fine. But,
right. Well, just so you know, I was on two...
Let me finish what I'm saying.
Okay.
People that take methadone for addiction, which is 100 milligram dosing, they have more pain than patients that take it at lower dosing, even if they don't have a pain problem.
Okay.
It actually causes more pain at higher dosing. You get hyperalgesic to it, which means it causes everything to hurt. It amplifies your pain fibers. It's not like blood pressure medicine. Where the more you take, the more benefit you get. There's a point with methadone that it actually makes you worse from a pain standpoint.
Okay.
All drugs, actually, even oxycodone.
Right.
And most people think that's about 50 milligrams a day. You're past that.
Right.
So I'll be happy to talk to your primary care doctor about it, but I don't think raising it would give you a whole lot of benefit for very long.
Right.
I think it would eventually make you worse.
Can I? This is Tone's partner. I was actually in the meeting with you. I don't know if you remember me at all, but hey, how you doing?
Yeah.
I think we're
good.
Good. Appreciate the consultation. I think where Tony's coming from is that prior to arriving in Washington, in Hawaii, he did have a higher dose and he experienced a higher quality of life. He was able to get out and actually do some physical exercise and to participate in life.
How many years ago was that?
Well, it was
5.
Yeah, it was 5 years ago now. And so, yeah, and you're right, you get older and the risks increase and stuff. But I know that's where he's coming from, is that in Hawaii he had a much higher quality of life.
They had me on 250 milligrams of methadone, and then over 10 years they reduced it down to 90 milligrams, and then when I arrived in Washington they reduced it to 20 milligrams overnight. I think I told you about that. And
that was a mistake.
It was really bad. It put me in the hospital. And so they adjusted it.
The problem you're running into is primary care is not going to do that. I'm not comfortable doing that. So I don't know that you're going to find, there's Dr. Rochford in Port Townsend who may feel differently, but he's about the only one.
Is he a pain specialist?
He's a family practice person that does pain, yeah.
Oh, Okay, I've never heard of him. He's at the Port Townsend Hospital.
No, he's in a private practice in Port Townsend. He has his own practice.
Okay,
But
and
I mean, I think
you think he has a
you know,
different look at it?
I mean, I don't saying what you're that you don't. I'm not disagreeing with what you're saying that that's how you felt.
Right.
I can tell you there's zero science behind that. All this science points to the opposite. So you're going to have a hard time convincing any person that's paying attention to science that that's a good idea.
Well, sometimes science and real life living. I've lived more when I was on the higher dose of methadone. The last 5 years, I've gotten out of bed about 20 times, all to go to the hospital. That's the most I've done.
I don't know. I can't tell you. We have to deal with what
Right.
what's out there.
Right.
We cannot make a decision that we truly have evidence will make somebody worse.
Right.
It's like treating a cancer patient with something that you know isn't going to help them.
Sure. Nope.
So
I will opt.
I've never been in your situation.
Right.
I believe you, but I can tell you there's no one that's going to give you.
Then I take it into my own. Then I have to take it into my. Right. Then I have to take it into my own hands and do what I need to do. And there is death with dignity.
Well, that's a totally different problem.
No, it's not.
But,
No, it's not.
Said,
it's called.
If you do get hooked up with palliative care, they have different guidelines than we do.
Okay. Well, if you would talk to Dr. Powell and let her know whether or not you think I'm on something that's appropriate for what I have.
Well, I think what you're doing is fine.
My
question is, my concern is that, if she increases it, which I don't know if she's comfortable doing anyway, but
she won't. She
while,
won't increase it without your approval. So she'll keep it exactly where it is, and I'll continue laying in bed for the next 5 years until my heart gives out.
Well,
let's do this. Tell her to increase it to 80, and if you get 10% more active, 15% more active, because that would be a 15% increase, then we can have this discussion. If she increases it to 80 and you're still in bed, then clearly it's not moving in the right direction.
And you don't think that hydromorphone is doing much help to me?
I don't know. I mean, you're such on a huge dose of methadone. I'd be surprised if it is.
With the methadone, how do your patients divide it up? Do they take their dose all at once, or do they divide it out?
Usually, they divide it out 3 times a day.
Okay.
3 times a day.
Wow. Because I do it twice a day. And
yeah,
so.
I mean, I think the methadone, even though it lasts a long time, the pain benefit is 8 hours and it starts dropping off. So
if you don't take it 3
times a day.
Okay, I see.
Right. What we've been doing, just so you know, and it's something that I've worked hard on developing, with other people and for Tony, and that is, really getting his body as healthy as possible and getting.
I think he needs to work on his mind too. I mean, I think this, pain is 50%. No matter if you're dying of cancer, what it is, it's
right.
50%.
For the last 3 years.
For
the last 3 years, I've been.
And I think you do need to get involved with some behavioral health, but I think you need some psychology, and you need all those things, which palliative care can bring together.
Okay. For the last.
You can't do that in Seattle.
Right. For the last 3 years, I've been going to a behavioral health psychologist twice a week. So.
Good. That's helpful. Good.
That's one thing I've done, but I haven't gone to a psychiatrist or anything like that. When I get this level of pain, I've noticed that the I can't see. The anxiety medication that they gave me 5 years ago isn't working anymore like it used to, and so is that something that also fades away after a while?
No, sometimes it needs to be changed. I mean, I think that's what psychiatrists do. I mean, there are different combinations work better for different people.
Okay. So I should try to get in to see a psychiatrist?
Yeah, that's going to be a challenge up there, but I would strongly recommend it.
Yeah, that's been another thing.
The other thing is, if we can come up with some non-opioid options for because we use a lot of different medications. We don't just use opioids.
Right. No, I've
What
used.
else have you tried besides just methadone and opioids?
Right. No,
What have you tried in the past?
I've used TENS units and all the different
No. I mean anything like pregabalin,
gabapentin.
going to help nerve pain.
I've taken everything from 300 milligrams to 1200 milligrams of gabapentin a day, and that irritated my skin. Um, I'm trying to think.
Have you ever tried
Lyrica, Celebrex, Vioxx, Voltaren. Most of those are anti-inflammatories.
They are.
What are
They're
you?
not going to help your nerve pain.
The nerve pain. Okay, so I don't have anything other than the gabapentin that I've tried for the nerve pain. Like,
Okay, well, duloxetine or Cymbalta is a nerve drug we use a lot. So I could talk to your primary care about that one.
okay,
Pregabalin is one we use a lot.
okay, that would be great because my feet. You remember my feet? They come off like a piece of tire.
Well, I think all your skin is nerve pain.
Right.
That's why it hurts so much.
Okay.
So let me give her, see if she's, because some of those, will take approval from Melina.
Right.
But I mean, I think that would be a better option. Try to load up on something that doesn't seem to be giving you the benefit you want right now.
Okay.
If you try a combination of other medications.
Okay.
He's tried several antidepressants, that are also purposed for pain management, and has ended up sort of being very it was kind of hard to tell whether the pain management, he felt very zombie-like, is what I remember.
Yeah.
Well,
it's all dose related, so I mean, you don't want to get to that point.
Right. Yeah. Anyway, I just thought I'd throw that in there, because he has.
Well, I think, like I said, I think as far as opioids are going, I mean, I think it's going to be an empty bucket. I mean, he's been on them so long that even at high doses, it's not going to be that effective.
Okay.
I mean, it's just unfortunately the physiology of the drug in your brain.
All right.
It's not just you; it's 100% of people that take them.
Yeah.
So I'd like to, maybe give, your brain a different type of drug to try to deal with.
Well, one benefit that he's had.
Don't get tolerant to.
Right.
I got a question for you as a pain management specialist. Because because he does have these times where his skin clears, and so obviously his pain level does drop, during those periods of healing, when he's actually healed, and he will bring down, his dosage a little bit, right? Because he doesn't like taking, these things, and then.
Well, he really can't. If it's just for a couple of weeks, he can't, because he'll withdraw.
Right.
And it'll make his pain worse than it would be without dropping.
Right. That's what my question was.
Yeah, even with drugs like gabapentin, if you stayed on it, or some Voltaren, some of the other ones, you can't just drop them. You got to do it over months and months. So
even if because this was an idea that I had, which I wanted to ask you about. If when he clears up, if he dropped, by 2 pills a day, and then increased them, by 2 when he's doing worse, or is that something you can't do?
I think he'd withdraw, because if you drop more than 10%, you're going to withdraw. So if you drop 20 milligrams out of 70, that's more than 10%.
Okay.
Okay. I just was trying to think of.
Even if it wasn't a full huge withdrawal, he got agitated and restless, and having insomnia and that kind of stuff.
Right. Yeah, I guess in hindsight, the one time that he tried that, there was, he goes through so much pain that it's.
He's got a miserable problem.
Yeah.
No one's seen it before. No one knows how to deal with it.
Yeah. I by the way, I had all my teeth removed because of this. It was in my mouth and it just destroyed everything. So I have no teeth now.
Did you have teeth?
When was that?
2 years ago.
Yeah, that's a shame too.
Yeah, and the dentures seem to cause my gums to almost break out. And so I only wear them when I absolutely have to. But it's kind of a
Let me try to talk to your primary care doctor next week.
okay.
And see if we can come up with some options. And I'll also try to see if we can get palliative care, at least to do a consult.
Is that the same as home health care?
No, they kind of work with home health care, but they're physicians that deal with, chronic illnesses that, limit people.
Okay. All right, great.
They do have a certain time frame, and I use them all the time because I do inpatient stuff, and we work together with them all the time in the hospital.
Okay.
They have a different outlook. They try to get more of the spiritual and the physical and all that part
Put together. I am going to I'm going to keep the dermatology group at the university because
Yeah, no one else I think would know what to do with you.
they're really good, and I'm also going in a week for a stress test on my heart because they found some things wrong with it. I had a heart attack in 2008 when I first got this disease. The first week I got it. And so since then I've been fine. I have never had a heart problem or heart trouble until last about a month and a half ago. I started getting pressure in my chest and I started getting shortness of breath. So we started down that road and we did a lot of tests, and then all of a sudden I took the COVID shot and that sort of stopped everything.
Yeah.
So I'm back on the bandwagon with the cardiology starting in about a week and a half.
Okay, good.
All right.
Let me talk to her, and if she wants me to touch base again, we'll call and set up another virtual visit, all right?
I really appreciate it. It's a great advantage for me not to have to make the drive.
No, I see no reason for you to take that risk.
Well, thank you, sir. Hope you had a great holiday, and I appreciate your time.
Okay, well, we'll be in touch.
All right. Thank you.
All right. Okay, bye.
Bye-bye. What, do I get too aggressive?
Well,
What the fuck am I supposed to say?
They're not gonna budge.
He budged. He said he'd add 2 more.
No, she has the option to
But
add
she
more
said
and
she would
see
do
if it
whatever
helps.
he said.
Yeah, but now you don't know whether he's going to say, "Oh, you should try,"
Well, palliative care
Cymbalta.
is, just so you know, palliative
For
care is
dying
something.
people.
Yes, it's something that I
Yeah.
asked Dr. Lewis, and Dr. Lewis said I wasn't there yet.
Yeah.
But he's saying there is no. They're wrong about the methadones.
I know they are.
They're totally wrong.
I know they are. And that's why I busted in and said, when you were in Hawaii, you had
I had a life.
Yeah. You had a
And it
fucking
didn't
life.
make my pain worse. Oxycodone makes my pain worse.
Yeah.
Percodan makes your pain worse.
Yeah.
They're rebound drugs.
Yeah, and at the end of the day, they talk about this science bullshit. Oh, science. Well, you know what? The science fucking 10 years ago said something very different.
Yeah.
The science 10 years ago said that it didn't matter how much you took, that there was no upper limit, okay? And that, you know what? When you're facing death in the face, who fucking cares? So, but you ended up, back.
He's a real cool cat. He doesn't get mad.
I know.
And that's why I push.
But you need to not.
You always tell me I do it wrong.
No,
it's astonishing.
No, you did great.
No matter what I do.
Tony, you did great, okay? But I didn't want them to start back down the road of the antidepressant fucking solution. He said half of any pain, even if it's cancer, is in your head.
Yeah, it's not. Until you get it, buddy.
Yeah, it's like, why don't you come here and let me pour fucking hot oil
Babe,
on your skin?
I need you to turn the oven on.
Okay.
I'm sorry.
Yeah, No, I was just what I was afraid of was that he would start thinking, well, we should just pull off methadone.
Well, he wouldn't shut up long enough for me to say, I've been going to a psychologist for 3 years
I
straight.
know, but you know what? You went way off the road. He was there to do one thing, Tony. Confirm with your doctor to stay on your.
And he said he would.
Yeah, but you went so far off the road. Okay.
Well, what do you want me to do?
Tell
Lay
me.
in bed for 5 more years because
No.
you don't want me to take more?
No. But you know what? Once you realize that he's not going to go down that road, he gave you something. He said that doctor blah blah. Okay.
What was his name?
And I don't remember.
Well,
But
you recorded it.
But you can. Oh, I did.
Yes. That guy
So-
seems like someone who is like Dr. Bloom.
Yeah, because some people